So John is a 5-year-old Down syndrome patient that has come into the office, and he is missing congenitally missing some adult teeth, and he is also having has heart conditions and respiratory conditions that come along with Down syndrome. There's a lot of work that needs to be done to help with the teeth that are congenitally missing and the misaligned teeth of the primary teeth. So, anyways, that is my topic. So, if I were talking to the parents, they would be coming in, John be sitting there. Most likely, as a Down syndrome patient, not all the time, but a lot of the times they can be very hesitant and reluctant to be there. You have to just kind of make them feel comfortable and get used to a dental environment if they aren't already. And they might be really scared or have been, and they just don't like it. They're very set in their ways and comfortable with what's normal to them. So talking to the parents about your concerns, of course you want to discuss with the dentist first about where you're at with it. The dentist would, most likely be like, yes, I think we should refer them to a pedodontist. So talking to the parents, you would, explain what's going on first, what you see, and how there could be a positive outcome as long as it's taken care of early. So with the misaligned teeth and probably needing sedation and things like that for the patient, but pedodontists go to the hospitals and do work for ones that have respiratory issues that can sedate there. So it's and it's a happier, healthier environment for a kid, just because there's or even somebody with Down syndrome, to make them feel more comfortable. They have TVs and toys and just like a fun open bay environment. Seeing other kids get worked on could really motivate John to feel comfortable being around other kids and seeing that they're okay and he's going to be okay. And they would be able to be more specialized in the treatment planning and give him everything that he deserves. So going to a pedodontist would really, really be beneficial for multiple of those reasons. One, just for the comfort and feeling safe and secure, which Down syndrome patients need. And then a really big factor as well would be doing any kind of treatment or restorative work or oral surgery of any type would need to be done at a hospital, because the respiratory issues and the cardiac issues. So a lot of things come into play with that. And then of course the parents had any questions, you'd be able to answer them or address them, like what are your options, like what's the difference. And if we were talking about Jacksonville, some of the options would be like Hallie White, or I think there's Happy Tooth out towards Wilmington. Dr. Egg, I think, is out towards Wilmington. I think there's a couple other ones around here that I'm not very sure of, but based off of your practice and what your doctor is referring to, you would give them those options. Of course, you want to look at insurance and things like that as well. There's a lot of things that come into play with referring a patient depending on what office you're in. Make sure the office is in contact with you when the referral goes out. So if they have questions or you have to transfer any x-rays, you have all of that there, and there's full communication between the pediatric office and your office, and a good flow from you transferring them to there. So yeah.